I'm Nima Rajan, and this is Forum Daily Week in Review. A new report from the Canadian Centre on Substance Use and Addiction says labels on booze containers are needed to warn consumers about the serious risks linked to alcohol consumption. The new guidance is based on the findings of 23 experts. They analyzed close to 6,000 peer-reviewed studies during a 2-year process that also considered public feedback. Now, according to the most recent available data, alcohol is associated with a number of cancers, including breast, colon, mouth, throat, and liver. Well, joining us now to talk more about this issue is Dr. Tim Naimi, director of the Canadian Institute for Substance Use Research and a member of the advisory group that designed the new guidelines. Dr. Naimi, welcome to Forum Daily.
Oh, thanks for having me.
Now, we all know that drinking can be bad for you, but what sort of new information has this report revealed when it comes to drinking alcohol?
Well, I think basically what a lot of the science has been showing over the past 10 to 15 years is that the risks start to go up at levels that are quite a bit lower than have been appreciated before. So they start to go up as little as over 2 drinks per week, which is a surprisingly low amount. So our objective here is to inform Canadians about the risks of alcohol consumption, and to the extent people are willing to cut down on their drinking, that would be wonderful for their health.
All right, so what exactly are these guidelines specifically calling for? What would these labels look like? What would they say?
Well, one of the things is we're trying to help people understand different risks of drinking based on how much they drink, so they can make informed choices about whether they might consider cutting back on their consumption. The problem is that in Canada, there's no way of knowing what a standard drink is to even assess one's level of risk. So what we're calling for, in addition to giving information and guidance to citizens, we're also calling for labels, mandatory labeling of alcohol products. So that would include things like defining in, let's say, a bottle of whiskey, how many standard drinks are in this bottle and what is the volume that constitutes a standard drink, as well as things like, warning labels, particularly for cancer. Alcohol is an important cancer-causing agent. None of that information, or even the calories in a drink, has more calories per gram than sugar. None of that information is found on the bottle, and I think we think that consumers have the right to have that information in an accessible way.
Now, these guidelines are quite a drastic shift from previous guidelines back in 2011. I believe it's 15 drinks for men and 10 drinks for women a week. So tell us a little bit more about these new guidelines and the effects and risks associated with even small doses of alcohol.
Yeah, and again, a lot of that is because of the shifting science that, the effects particularly on cancer, and also actually the surprising effects of increase in heart problems, even at what we would have thought before were relatively low levels. We're not telling people to go for one number. We're defining risk zones. So for up to 2 drinks a week, which is a small amount of alcohol to be sure, that's the kind of the lowest risk zone for people who drink. And then 3 to 6 would be sort of a moderate one, and then it goes up beyond that. But again, our idea is not to tell people to get to a specific level, but to encourage folks to cut back from wherever they are. And even if somebody's drinking 6 or 7 drinks and they can cut down to 4 drinks per day, they're going to do themselves a world of good. So we don't want to just tell anyone, like in previous guidelines, this is the one number you got to try to get to, because we want to work with people where they are, but we also don't want to pull our punches scientifically. We want people to understand the risks and to be informed.
All right, just about a minute and a half left here, but I really want to jump to your particular research when it comes to this report. So we know you looked into alcohol attributable death and disability for this final report. What were your findings, doctor?
Well, again, what we find is that above 2 drinks per week, you have an increased risk of having an alcohol-caused death or a portion of your life removed. For each alcohol-caused death, it actually happens among, as we know, a lot of young and middle as well as older age adults. So this is not just like losing time at the end of one's life. So that's what we do. Without getting into too much gory detail, we look at the risks for each of the conditions that is known to be related to alcohol and kind of put together a composite risk curve for people, and that's how we arrive at our estimates.
All right, doctor, just a quick 30 seconds left here, but if there is one thing you want our viewers to take away from this conversation, what would it be?
Well, the one thing is that, again, when it comes to alcohol, it basically boils down to that less is more. Less alcohol consumption is associated with longer and a better and healthier life.
Less is more. All right, Dr. Namey, thank you again
More.
for your time today.
Thanks so much for having me.
All right, well, after the break, we take a look at the debate over public and private health care. Our interview with Colleen Flood, Research Chair in Health Law and Policy and Professor at the University of Ottawa, is up next, so stay tuned. We'll be right back. The private healthcare debate has been sparked again following Ontario's move to expand the delivery of public healthcare services to private centres. Premier Doug Ford says this is in an effort to help eliminate the backlog of procedures. Now, he says these procedures will continue to be paid for by the Ontario Health Insurance Plan. But critics are concerned about what the plan will do to hospital staffing levels. The announcement has also garnered a variety of reactions from the Prime Minister and other federal leaders in regards to maintaining the universal public health care system. Well, joining us now to give us deeper insight into this issue is Colleen Flood, Research Chair in Health Law and Policy and Professor at the University of Ottawa. Ms. Flood, welcome to Forum Daily.
Thanks for having me.
So let's start by going over this new three-step plan in Ontario and what exactly it will look like for patients in the province.
Well, I think that's a tricky question because there's not a lot of detail provided. But essentially, it sounds like the plan is to expand the sort of current array of services that are provided through private for-profit and not-for-profit clinics outside of hospitals. So the usual things like diagnostics, MRIs, and these kinds of things. But then to further expand eventually into other kinds of elective surgery, so cataract surgery and hip surgery. But there's not a lot of detail provided as of yet of how all of this will occur, how it will be regulated, how it will be funded. So we just have a general sense of expansion sort of slowly, but then ramping up into areas that historically, have been delivered inside public hospitals.
Now, meanwhile, we're hearing a lot of concern around the stability of the public healthcare system and hospitals amid these investments in private care. So, what are your thoughts on this? How would this likely impact the public system?
I think the biggest concern here is the diversion of nursing staff to these centres. And, we already have such a problem at the moment with the burnout and toll that particularly nurses, but other healthcare providers have endured for the last 3 years of the pandemic. So, to set up perhaps another place where they might be able to go and work rather than inside the public hospitals is quite concerning right at this point in time. Perhaps at another point in time, if we felt we had, a robust supply of nurses and other healthcare providers, it wouldn't be so worrisome. But I think, up and down the country where we've heard terrible stories of overcrowded ERs, people dying in ERs, people not being able to get care for their kids, many people not being able to even get into a wait list because they can't see a family doctor to even, be queued to see a specialist. So, for my 2 cents, this is where, if we've got an ounce of extra capacity, I would hope that this is where the government would really be trying to put the resources. This is where we really desperately need it right now. And not to say that addressing wait times isn't really, really important for cataract care and hip operations, but I think right this moment the crisis is in the ER and in primary care.
So, what would be your suggestions around improving the public healthcare system from your own personal perspective and research on healthcare systems around the globe? Just about a minute and 20 seconds left here, ma'am.
Well, yeah. Oh, you don't want me to give you my doctoral thesis. The first thing that would be great is if we actually had a central queuing system for folks, so that instead of my family doctor just sending me to the orthopedic surgeon or the cataract surgeon that she happens to know, that there's an orderly kind of procession through regional or provincial methods, so that I'm matched onto the first available surgeon depending on my acuity. So we have no idea, when my lovely family doctor, I'm so lucky to have one, sets me up with, orthopedic surgeon or something, whether someone just down the road or, an hour's drive away might have had a cancellation. So, these are some pretty low-hanging fruit that we could really do really quickly, to improve people's access to care and give them security, that they aren't just sort of hanging in the wind, that, that the system is looking after them and that their needs will be met just as soon as humanly possible with the resources that we have.
All right, Miss Colleen, thank you again for your time today on Forum Daily. We appreciate your perspective.
My pleasure. Nice to talk to you.
Coming up, we're going to take a look at the Mohawk Institute Project and Reconciliation. Stay with us. The latest discovery of possible grave sites at a residential school in Saskatchewan has been described as difficult news by the Prime Minister, but it does not come as a surprise to many residential school survivors. The Star Blanket Cree Nation announced last week that ground-penetrating radar has identified more than 2,000 potential targets at the former Lebret Residential School. As more residential school sites and potential unmarked graves continue to be found, one former site is looking to repurpose its grounds for learning, healing, and truth and reconciliation. The former site of the Mohawk Institute Residential School in Brantford, Ontario, is being turned into an exhibition to further tell the stories of those who had lost their voices and, for some, their lives. Well, joining us now to tell us more about this is the Woodland Cultural Centre's Executive Director, Ms. Janice Montier. Ms. Montier, welcome back to Forum Daily.
Thank you for having me.
So let's start with last week's discovery at the former Lebret Residential School. How have the survivors and First Nation communities that you speak to been reacting to this?
Well, I think it's definitely something that we knew was going to be discovered at residential school sites across this country. But again, it's the numbers are the thing that's really hard to, I think, come to terms with, is as many that they're suggesting that have been found of interest in Star Blanket, to over 2,000. It really shows just how many lives were lost of children who attended these institutions across this country, and with it not being reported or not being acknowledged.
And as you say, survivors expect to hear a lot more about grave sites being found at former sites, former residential school sites. So can you tell us a little bit more about the importance of this search and how it's going to help Canada in its efforts toward reconciliation?
Well, I think it's important that these searches continue to happen. We need to understand the truth, and we need to also bring some closure to our communities about the tragedy around losing children that went to these institutions, and really to, I think, acknowledge just how horrific the living conditions were, and the treatment of children, of Indigenous children that attended these institutions.
Definitely. Now, we do know the former site of the Mohawk Residential School is being repurposed, so let's talk a little bit more about that. What phase is it now in its development, and what will this site look like once it's complete?
So we're currently in phase 3 of our restoration work. So we're making it sure that it's accessible. So we're installing an elevator. We are ensuring that all the masonry is repaired and windows are repaired. So that's sort of the phase we are in now, and that will continue well into the spring. At the same time, we are starting phase 4 in a few weeks. That is the interpretation phase. So really ensuring that when we do reopen in late fall of 2024, visitors will be able to experience what life was like as a child attending one of these institutions. It'll be a guided tour of the space, and really the artifact itself is the building. It's really going to be focusing on the stories and testimonials we've heard from survivors over several years, guiding the narrative and the script of the experience. So we hope that when visitors come, they'll come see the rooms as they once were when it was running as a residential school.
Really looking forward to the opening of this exhibition, Ms. Montier. Now, what are you hoping people will take away from or feel after visiting this exhibition?
I hope that when people come through this site, that they really truly understand not only the historic aspect of it, but also to really understand what it was like to be a child. I think when we hear the stories, you see the survivors are now elderly and older. It's hard to imagine what they're telling you, to know what it would have been like to be 5 years old, and what the living conditions were and what happened to them. Several abuses that were done to these children is unfathomable to, I think, a lot of people. And so we really hope that people understand the truth first and are really open to hearing those truths, because they are hard to hear, but we have to ensure that we know the truth before we can do any sort of reconciliation work, before we move forward.
Stories that need to be told. All right, Ms. Montier, thank you again for joining us today on Forum Daily.
Thank you.
All right, after the break, we take a look at cybersecurity in Canada and how to stay safe. Our interview with Robert Falzon from Checkpoint Canada is up next. He'll unpack the latest trends in cyber threats, how they've been evolving, and how you can protect yourself against them. Stay tuned. Forum Daily Week in Review will be right back after the break. Stay with us. Cybersecurity experts are offering tips on protection against cyber attacks. Robert Falzon of Checkpoint Canada says keeping computers and mobile devices up to date with the latest software is critical. Mr. Falzon also suggests that people download ransomware protection software and be hyper-aware when opening emails or text messages from unknown sources. The Rogers Cybersecure Catalyst Center at Toronto Metropolitan University says the use of ransomware is growing as part of a multi-billion-dollar global crime industry. Well, joining us now to discuss cybersecurity in Canada is Mr. Robert Falzon himself. Sir, welcome to Forum Daily.
Thanks for having me.
So as we mentioned, the use of ransomware is growing. So what do we know so far about the scale of cyber attacks in Canada in particular?
It's quite incredible. We've seen an over 20% increase in attacks for Canadian enterprises and Canadian companies over the course of the last year or so. So it continues to dramatically increase year over year. So this is not a problem that's going away anytime soon.
Very concerning problem there. Now, as technology continues to evolve, so do the threats against it. So can you tell us a little bit more about how cyber threats have been evolving most recently?
Well, what's happening really is that we're seeing now that tools are becoming more and more accessible to more people. Hackers that maybe not are as skilled as some of the ones that are the most dangerous are now finding themselves empowered with tools that are using artificial intelligence and machine learning to create attacks and to help them form different types of attacks and malware that is actually quite efficient and quite effective at attacking people. So we're seeing more and a broad range of people entering the attack marketplace, if you will.
That's really concerning that less skilled hackers are being given the tools to hack your personal information. Now, in terms of victims, we've been seeing some really big targets lately, LCBO, Sick Kids, Royal Mail. But what is the risk to maybe smaller businesses and individual Canadians here?
Well, certainly risks to brand and things like that, what we typically think with any problem that you would have with a product or a service, right? But there's also, in some cases, these things can affect your health, right? We start to see theft of things like medical records and certainly financial information, especially from those most vulnerable or more vulnerable populations even. These kinds of threats become an incredible problem for them as well. So I think that we're going to continue to see that type of attack even on the smaller mom and pop type of organizations.
So what can these small businesses or individual Canadians do to protect themselves, Mr. Falzon?
I would say straight up cyber hygiene, right? It really goes back down to the basics. There's an old saying that says you don't have to run faster than the bear. You just have to run faster than everybody else running from the bear. So if you take even basic level protections for yourself, change your passwords, make sure all your things are up to date, all your patches and software for your computers at home and your devices and things that your kids use. Make sure that those things are all up to date and you're already going to be better off than the next person. And just be more aware and make sure that your children and those around you, maybe even the elderly, are taken care of as well, because they might not be as up to speed on some of these technologies. Help them as well.
And are there any maybe policies that officials should maybe consider when it comes to improving cybersecurity in Canada?
Yeah, there's a place for legislation here for sure. I think the government can be doing more as far as helping businesses to develop and maintain security policies that are implement accountability mechanisms, right? Make sure that they're held accountable for when they have poor cyber hygiene or when they mistreat customers' data. We need to improve some of those protections for Canadians in order to make sure that this is better looked after.
And how does an expert such as yourself protect against cyber threats, against your company, against your own personal information?
So I'm very fortunate. I work for an organization that develops these tools. So I'm constantly updating my tools and the certainly my operating system and things for the devices that I'm using. But I also have the benefit of a number of researchers that are helping me to spot the threats. So I spend a lot of my time really helping others to spot those threats as well and become more aware.
All right, Mr. Falzon, about a minute left here, but if you could leave our viewers with just one message or one key piece of advice when it comes to cybersecurity, what would it be?
I would say to educate yourself, learn a little bit more, and understand that I always hear hackers wouldn't be interested in me because I'm not interesting or I have nothing to hide or anything like that. It's one of the biggest fallacies. The problem is everybody's at risk. You, your parents, if you have children, them. Just make sure that you're taking the basic steps to protect yourself. Again, that will set you in a better place and make sure that you're not the next victim.
All right, Robert Falzon from Checkpoint Canada, thank you again for your time today. All right, I'm Nima Rajan, and that'll do it for your look at important conversations from this past week. Remember, for more news on demand, you could always visit our website, thenewsforum.ca, and make sure to follow us on our social media handles. We're available on Facebook, TikTok, Instagram, and Twitter. You could also watch all of our news programming on the News Forum YouTube channel. All right, stay tuned for other commentary programmings that cover economics, politics, Canadian law, and social issues affecting Canadians. Thanks for joining us again on the Forum Daily Week in Review, and we'll see you again next time. Take care, Canada.